Hi everyone, I'm Dr. Motahare, and in this episode, we are going to talk about one of the most common questions these days. Is it a cold or a flu or COVID-19? Every year around these times, many people start coughing, sneezing, running, fever, body ache, and things like that. And worry what exactly is going on, especially after COVID-19 pandemic. In this video, we will discuss how to recognize the differences, how to care yourself at home, and when it's time to visit a doctor. Let's dive in. Respiratory infections are very common in the cooler months, and most cases falls in three main categories in adults, not children: common cold, influenza, and COVID-19. While they share many common symptoms like cough, sore throat, and fever, they are caused by different viruses and can vary in severity. Most colds are mild and short-lived, but influenza and COVID can lead to complications, as all of us know, especially in people with chronic conditions like diabetes or COPD, lung disease, heart disease. Elderly, in elderly, they can cause severe problem too, and also in very young children. Let's compare the typical pattern of these three. A common cold usually starts with sore throats, especially this is an early sign. After that, a sneezing, runny nose, and a mild cough. It's gradual. It's not sudden. Gradually, you just feel some sore throat, then sneezing, mild fever, and mild cough. But influenza begins suddenly. Today you are very good, you have no problem. Tomorrow suddenly you have high fever, and chills, body ache, and fatigue. COVID-19 has very many different ways, many different shapes. Some like cold, some like influenza. Sometimes you lose your taste or smell. Many different forms that we all of us just saw during that terrible time. While there are some clues, but it's not always possible to differentiate between them just by symptoms without testing. If it's crucial for us, for management, to know what exactly the virus is, we should do the testing. Otherwise, it's not needed. And we cannot go tell 100% that this is this virus or that virus just based on the symptoms. For most mild respiratory infections, the best treatment is just supportive care. What does that mean? It means that we should get enough rest, stay well hydrated, using paracetamol or ibuprofen if you have fever or body ache, eat good food, nutritious meals, and use simple remedies like nasal saline sprays or warm salt water gargles for congestion and sore throats. Avoid antibiotics unless prescribed by a doctor for a reason. They don't work against viruses and may also cause side effects and also antibiotic resistance, which is a big danger for all of us in near future. To stop infection spread, if you are sick, stay home until you've been fever-free at least for 24 hours without medication. Wash your hands regularly, you know these things. Cover your mouth and your nose when coughing or sneezing. Wear masks when you are around the others, especially if there is any older adults around you or pregnant women or any people with chronic underlying disorder. And think like keep room well ventilated, open the windows and clean common touched surfaces and think like that. These small actions can make a big difference in reducing the spread, in infection control. So when we should see a doctor? Most cases get better in 1 week, but there are warning signs you should never ignore. This is very important, alarming sign. If you have difficulty breathing, chest pain, persistent high fever, confusion, or severe weakness, it's time to seek medical attention if it's even in the first day. Okay? If your symptom improves, but after that suddenly worse again, that may indicate a secondary bacterial infection. And also always remember high-risk individuals, which are older adults, pregnant women, and those with heart and lung and immune system problem should see a doctor as early as possible. They should not wait even 1 day. So if you have the alarming symptoms like you don't have any underlying disorder and you are not an elderly, but you have these symptoms: chest pain, your chest is heavy, breathing difficulties, shortness of breath, or you have persistent high fever, or very severe weakness, or you are getting better but suddenly you get worse, you should see a doctor. And if you are in the high risk category, even with the just first sign, you should see a doctor and ask for help. Here is a simple guide to help you decide what to do. If your symptoms are mild, such as just a runny nose, mild cough, or low-grade fever, stay home, rest, and monitor your condition. If symptoms worsen or you belong to higher risk group, contact your healthcare provider. If you have emergency warning sign like shortness of breath, go to the hospital immediately. Do not waste time. When in doubt, you don't know what to do, it's better to see a doctor. Ask for professional help. So when you are not sure about your condition, always ask from a professional doctor to help you. What is the role of testing? Testing through rapid antigen test or PCR tests can confirm whether you have COVID or influenza. But actually, for most healthy individuals with mild symptoms, knowing the exact virus is not needed because treatment is just supportive care, and supportive care is similar in all conditions. So, but in high-risk patients, testing can help us decide if we need to start antiviral therapy or not. Early, very early, in 24 to 48 hours from starting of the symptoms. CDC recommends prompt treatment for people who are at high risk, like pregnant women, like people with asthma, chronic lung disease, diabetes, or heart disease. But always avoid unnecessary medication. Never self-prescribe any antibiotics or steroids. They will harm you much more than benefit you. Okay? Let's summarize. Cold, flu, and COVID-19 can look similar in symptoms, but the key is to focus on how severe the illness feels and how your body responds. Supportive care works for most mild cases. Hygiene and good self-care remain the best prevention. And knowing the red flags helps you act quickly when it matters most. Red flags is very important. Red flags plus individuals with a past medical history. lung disease, heart disease, diabetes. Elderly individuals can get very sick before any symptom, just maybe a little weakness or falling down. And when you are taking them to hospital, you can see that a very severe infection is in their body. As we get older, the symptoms are less clear. The elderly will not show the complete picture of disease. We should be so sensitive for their symptoms. Even very mild symptoms in elderly can lead to severe consequences. And pregnant women is also very important because there are two people and both of them are in very special condition. So take care of red flags and also people who need quick response. Thank you for watching. If you found this video helpful, please like, share, and subscribe to the Art of Medicine with Dr. Motahare. Stay safe, stay informed, and take good care of yourself and your loved one in this season. Thank you.